If someone asked me about what appropriateness of care was, or choosing wisely was all about, it was about quality of care, ensuring that each patient gets the right care for them in their circumstance.
I think it's important for people, for patients, to realize that more care is not better. The fact that your doctor is doing more doesn't mean he's doing the right thing. A lot of the stuff we do to patients just because we can, not only doesn't add stuff to patients, but actually can decrease their safety. It can expose them to more risks.
When you talk about more is not better, I think, again, you need to look in the context of the patient. Sometimes it's easy if you have a blood requisition, and if I'm sending the patient for a blood rec for a specific test, it may be easy just to check that one more box and check that other box just in case. But anytime you're ordering a test for a particular patient, you should always look at, is this going to affect my management? Is this going to help me decide what to do, or help me decide what is the diagnosis? If you've done a test that you get back that's abnormal and you can't put it in the context of the patient, then you're left with trying to decide, what am I going to do? That probably is going to lead to more tests, possibly some sort of procedure that's going to put that patient in potential harm and certainly may not be of benefit.
If I was to think of a metaphor as to why less is better, meaning choosing wisely more or less, or appropriate investigations, I would say that it's a bit like going on a fishing expedition where my aim is to catch a lot of cod, but I'm casting this huge net which will more or less catch a lot of seafood, and 90% of it isn't going to be cod, and I have to sieve through those 90% and get rid of them and focus just on the 10%, but whilst I'm doing so, I'm going to possibly miss some of the 10% of cod, but I'm going to spend so much time trying to sieve through the 90%. Now, this is unlike a hunting expedition where I have certain parameters in my head that I'm going for, and there's a specific species or two that I'm going for, and this is really what choosing wisely is about. It's going for a patient-tailored approach, more or less. And this happens with a little bit more effort in the beginning to save a lot of effort at the end.
You know, patients ask us, do they really need this test, or do they really need this prescription all the time? And in fact, I had a patient who was quite sick and had been sick for some time. I didn't really have any good idea what was going on with her. She had a high fever. And when I went in the room at the end of the day, I was going to send her home because she was feeling a bit better, but I hadn't solved the problem and was going to have someone else follow her up. I said, I'm just going to prescribe nothing because I know you're going to come back if you get sicker. And her husband, who was a pharmacist, and I didn't know that, said, I didn't think you people ever did that. And it struck me kind of funny because we do, but it's sometimes easier to treat even if it's not the right thing to do.
If we can get people thinking in terms of risk and benefit at every decision they make, it's going to strengthen society. If we can get doctors to think of this and communicate this with patients at every time, it's going to strengthen medicine. Patients are going to have tests that are more appropriate and are more likely to help them. So the net sum of positive outcomes will increase. And that's what we really want for medicine. We want fewer people to be harmed by the system and more people to be helped by the system. And we want as few people to have stuff that they don't need. Because not only is it invasive on them, but it takes that away from people that do need it.